95.7 WCRC, Dirks Bentley there with Come a Little Closer. Joining me now, Dr. Ryan Jennings. He is the Chief Medical Officer from HSHS St. Anthony Hospital. Good morning, Ryan. How you doing?
I'm good, Gail. How are you today?
I'm great. I am just great. So, what are we going to talk about this morning, Ryan?
Well, I like talking about the sunshine. Boy, yesterday was gorgeous, but I guess we had a little bit of excitement in the night with the wind and the blow, so hopefully everybody stayed safe through all of that. But,
yeah, I've got to go home and check my roof in the daylight, make sure that my roof is fairly new, so I'm hoping for the best. And I really enjoyed yesterday, as you said. It was my official first top-down day with my little convertible, so I enjoyed that.
That's absolutely, and then, like I said, made it through the night safely. And what we're trying to do is still continue to keep everybody safe here in relation to COVID and all the activity that you've seen there. Folks that followed the website for Effingham County, et cetera, probably did note or undoubtedly noted that we did report an additional case within Effingham County, and in addition, there was a mortality that was reported for Effingham County. So I think it's important when folks look at that data to always remember that vitals, what we call vital statistics, meaning birth records, death records, infectious disease records, those types of things, are reported in the county of the individual's residence. So even if my residence is Effingham, but I've spent the last 6 months in, Chicago, and I become ill and die, that death is still recorded at the public health department in your county of residence. So, yeah, it's always concerning. We got several calls from folks concerned that someone had passed away, here at the hospital with COVID, and it's really the idea that it's the county of residence. It doesn't necessarily mean that the mortality occurred in the county, or that the next case actually, whether or not it's actually in the county itself, or it's just being reported there. So you always have to take public health data and realizing that it's done that way on purpose, because when the numbers become large, having those one or two cases that are a little bit off don't matter anymore. But when the numbers are still small like they are now, it can certainly cause some alarm.
Oh, that is so good to know. I was not aware of that, so thank you for explaining that.
Yeah, no, that's a change and new from there. IDPH also made some kind of minor changes around the recommendations for testing, primarily trying to now that their advice and their recommendations on who should be tested has stayed relatively stable. They continue to say that it should be patients that require hospitalization, those returning to a congregated living facility, or healthcare workers who are sick. So a healthcare worker that has fever and respiratory symptoms are really the three main categories where they're still recommending testing. But they've now allowed us as the hospital basically to run those through our own incident command, not having to pick up the phone and talk with the public health department directly on a test-by-test basis, rather be able to use those guidelines. And again, I think that reflects the fact that those guidelines now have been stable for a decent period of time, so they're not having to have every phone call come to them because they never knew when the instructions were going to change. And so the big picture hasn't changed as far as who does the testing and who should be tested. What did change is now we're able to process that a little more efficiently internally without having to loop the public health department every time. Now they still get all the results, and this is for testing that's going to the state lab. So they still get all the results, so that they will continue to help us with disease containment and tracking of positives and all those things that we trust our health department with. This, like I said, just kind of alleviated one step in the phone calls, which makes sense. At this point, I think everybody's kind of got the guidelines in their head and are following them as closely as we possibly can. No new news really on testing availability. It still remains a scarce resource. The IHA's update yesterday indicated that statewide the labs were running about 7,000 tests a day in total. Their goal was to be up over 10,000, but right now the supplies are still scarce enough that they've not been able to be running that type of volume. We are starting to see some additional activity around the quick test results, through Abbott and some of the other companies, and they are starting to roll those out a little bit more. But at this time, those have been deployed through the state and the Department of Defense to areas that are considered hotspots. So, knock on wood, that's a good thing to not need to be.
Yes, absolutely, absolutely. So there also, I understand, there have been questions between detection testing and immunity testing.
That's correct, and it is confusing, and a lot of times, the TVs and interviews and things like that, they kind of talk about it together, and then it kind of muddies the fact that you're really talking about two different things.
Right.
One is the testing of, do I have the disease right now or not, and that's the test that we're swabbing, when it's appropriate, sending to the state lab, and then getting a result that says yes, you have the disease right now, or no, you don't. Neither of which really changes what the recommendations are, because if you're not requiring a hospital stay, if you're positive or negative, you're supposed to be staying home and distancing yourselves and avoiding crowds and using good hand hygiene. So the positive or negative, if you're not in the hospital, doesn't really change the overall plan, because unfortunately, as we all know, there is no definitive treatment at this point, and certainly no treatments that are recommended for somebody who's well, is tolerating it well on the outpatient side. We are seeing more information around using hydroxychloroquine and things like that for patients that are hospitalized. But if you're well and able to stay in the community and self-quarantine, that's really still the best remedy. The other testing is the idea of testing for immunity, and that will be very exciting once we can ramp that up. And there are some collections that are going on now in areas that have had a large enough outbreak where they're studying their blood to then identify evidence of immunity, where they're looking for what are called antibodies. So after you've had a disease or you receive a vaccine for a disease, the body creates kind of these little things called antibodies that hook to that infectious particle, so that then the body knows to remove it. And that testing has just started, and they're just really getting better at identifying what immunity looks like, because if you knew you were immune, then you really could potentially be out in the public a little bit more and know, kind of like I had chicken pox before. If I go into a group of people with chicken pox, I either won't get the disease, or normally you would get it very, very, very mildly, because your body recognizes it immediately and takes care of it. The same hopefully will be true with this virus. Those that have had it will then have immunity, and if we can identify what it is in their body that is what those antibodies look like, and test for that, we'll hopefully be able to give some people a little bit more ability to know that they're able to go out safely. The negative test, some of the concern about testing the folks, just drive-through testing and that kind of stuff, is the idea that if someone receives a negative test, they're going to interpret that as the ability to go, well, I don't have it, so I'm good to go out and run around. Well, really quite the opposite. It's actually the opposite. You'd be the guy that's now doesn't have it, and for our knowledge, you've never had it, and so you're at risk when you're going out and doing something, and so having a negative test is not a ticket to Rome by any means.
No, it's not a get out of jail free card. Do not pass go. You pass go, get your $200. No, stay home.
Stay home. Absolutely.
You've been blessed so far, so keep your hiney at home.
That's it.
Yeah, absolutely. So once someone does have the disease, I've been doing a little bit of research on this, not much because I'm a lay person and I don't want to confuse the facts, but once the person has the disease, the virus, they recover from the virus, and so now they have these antibodies in their blood, in their body. Can they donate plasma, or is that correct, where they can help?
So our regional blood bank, our regional blood bank and many of the blood banks have started to collect what's called convalescent plasma, meaning somebody who has had the disease, recovered from the disease, and then should have these antibodies in their bloodstream as part of their plasma. And so what they're having folks do, and if and when we do have positive cases and have survivors of it, we can refer folks to the blood bank to go through this process. And they will actually collect their plasma. Now at this point, there's no ability to really isolate just the antibody. But we know that the antibodies live in the blood plasma. That's where they hang out. And so the idea is to then be able to transfuse plasma, which we do occasionally now for other reasons. If somebody's having bleeding problems, things like that, we transfuse plasma now. But if you know that plasma came from a donor that had COVID and had recovered, those antibodies hopefully are in there, and so you would infuse that into someone who is sick with it, and hopefully see the antibody response then kick up from the donor. So cutting edge stuff. I mean, this type of idea has been used in other diseases, and so we do know that it works, but it's not a benign thing by any means. Of course, anytime we're talking about transfusing a blood product, we always have to take a moment and make sure that that's the right thing to do.
Right, exactly.
So it's not a minor decision, but certainly, as we're going to learn a lot by collecting that plasma, and so I was excited to see the update from the regional blood bank saying that they are positioning themselves to start collecting that from patients that are convalescent. And I believe, don't quote me, I read it, and it's not tip of tongue, but I want to say they have to be 28 days or more out from the illness. Okay. So they have to have been fully recovered, basically plus a month, because by then the immune system antibody levels should be peaking, and then that's when they can go through this process to potentially donate.
Right, and hopefully people that have recovered will be very open to doing this and will come forward to help out with this.
I think they will. I mean, look at the phenomenal support we've seen.
Yeah.
Everything from making the cloth masks for us, which are still in need. So if folks are making masks, we absolutely will still accept those donations anytime, and they are being put to great use. And I mean, just unbelievable amounts of medical supplies and cash donations. You name it. That the generosity of our community continues to amaze me. And there's no doubt that if someone recovers from this, they'd be willing to participate in being part of the cure. Right,
absolutely. And by the way, I wanted to mention that there is a pattern for the mask that y'all prefer on the St. Anthony website, correct?
That's correct. That's correct.
So if anybody wants to make them, let's go to that website and use that pattern.
It's kind of fun. Well, it's not fun because I hate seeing everybody in a mask, but it's kind of fun to see all the different patterns.
Yeah, yeah.
got kind of nifty little patterns on them.
Yeah,
kind of something unique. If you're gonna have a bad thing, at least have some fun with it.
Yeah, I actually started a couple of days ago making them, but then I had to wait on the wire ties to put for the nose piece. So those are supposed to be here today because they are the plastic covered wire ties. But I ordered those and they're supposed to be here today. So then I can get back with it. So.
Yeah, it's a lot of that stuff, and you're experiencing it in all kinds of things. The shipping delays for any type of supplies that somehow relate to this pandemic are remarkable, and that's part of why we continue to ask for those donations of masks and things like that, because the supply chain is just disrupted. I mean, it's rather remarkable. So.
It is. Just we're learning new things every day, aren't we, Ryan?
We are, but now we are looking forward to Easter, and we want everybody to enjoy that opportunity and certainly continue to participate in your church services and things like that remotely. And be cautious with those family gatherings. Again, trying to not expose, especially those elderly folks, to somebody that maybe is asymptomatic and carrying it. So as we come into this weekend, certainly be mindful and be safe.
Absolutely. Ryan, thank you so much for joining us and taking the time out of your, what I know is an extremely busy schedule right now, to keep us updated on this.
It's my pleasure, Gail, and thanks, WCRC.
You are very, very welcome. We'll talk to you later.
Bye-bye.
Bye-bye. Later.
Bye-bye.
Bye-bye. Later.